Hi, welcome everyone. Today's webinar is Revolutionizing Stroke Care in India through an AI-powered hub-and-spoke model. We'll speak about the state of stroke care in India. We'll speak about the benefits of mechanical thrombectomy, how a hub-and-spoke model can ensure that more patients get to a mechanical thrombectomy, and lastly, we'll talk about AI and the role of AI in enabling the hub-and-spoke model. So I have got two panelists with me from Dr. Jeyaraj Pandian and Prateek Tiwari. Dr. Jeyaraj Pandian is a professor and head of neurology and the principal dean from Christian Medical College, Ludhiana, Punjab. Dr. Pandian is the current president-elect of World Stroke Organization and immediate past president of the Indian Stroke Association. He was the past chair of the World Stroke Campaign International Working Group of WSO. He's a member of the Strategic Advisory Group for NCDs in WHO Geneva. And Dr. Pandian was conferred the WSO Global Stroke Services Award in 2020 for his contributions to the field of stroke. He has made significant contribution to stroke care services, epidemiology, and thrombolysis in low and middle income countries. He's a national PI for the Indian Stroke Clinical Trial Network, Instruct. Mr. Prateek is working as Senior Director, Neuroscience and Specialty Therapies. He has been with Medtronic for over a decade, working across strategy, marketing, and sales. He's a bike rider, as I've seen, and a travel addict. He lives in Mumbai with his family. He's an alumnus of INSEAD Business School and IIM Calcutta. So we'll get the panel started. Dr. Pandian, can you hear me?
Yeah, I can hear you, Mr. Prashant. Yeah.
Thank you. Great. Thank you for joining us, Dr. Pandian. Really an honor to have you as part of this panel. So I wanted you to sort of speak to, with your experience, speak to the audience about the state of stroke care in India and what are the sort of shortcomings that we have and what are the big areas of improvement.
Yeah, thank you. If you look at this burden and looking at the stroke care, there is so much of disparity. If you look at incidence of stroke, it varies from 119 to 152. The incidence varies from 119 to 152 per 1 lakh population, and if you look at the annual stroke rate, it is about we are looking at 1.7 million new cases in a year in India, and the case fatality rate is somewhere between 22 to 42%. 42% is in the Northeast India, and we have recent data from Dibrugarh where the case fatality rate is touching up to 60%, and so there is a huge burden of stroke. And in order to address or reduce the burden of stroke, we need to have an integrated approach. If you look at WHO, they always look at prevention at a large scale, and prevention, lifestyle changes, screening for hypertension, it takes so many years to happen. And during this process, you need to reduce disability and functional independence. So that is where the stroke systems of care are very, very important. So if you look at India, we have this healthcare system which are largely private, and government healthcare system, we know it is so fragmented. Even in private also, it is most of the systems are unregulated, and to a certain extent, bigger hospitals, corporate hospitals have quality programs, etc. And so in this situation where majority of the patients go to government hospitals, majority of the strokes, so we need to really strengthen the government healthcare sector. And so that is where we need to put our bet and all our efforts into it. Private sector will improve. For example, the recent NABH and WHO stroke certification program that we have just rolled out, the private sector is just waiting to submit the application. Unlike government sector hospitals. So it is very, very important to focus on government hospitals. The second most important thing is the personnel. we know the ratio of neurologists to the population in India is around 1 per 1 million. And that also largely focused at southern part of India. And if you look at the neurologists, let's say about 16 or close to 2,000 we would have now, and only about 10% or 15% are interested in stroke, or maximum 25, depending upon the region where they come from. So one is you have the healthcare system which is fragmented. Second is the human resources. So in a situation like this, we need to, if we are looking at covering the government hospitals, then it is not neurologists we need to focus. We need to focus on the physicians, the MD physicians or DMD physicians. So those are the people who can drive the program. So we have examples which we have scientifically tested in Tezpur Baptist Christian Hospital and also Tezpur Medical College. In Tezpur, there are no neurologists. And before we implemented the stroke unit care, we collected the baseline data and then 1 month of training. And after that, we implemented the stroke unit care and collected the data. We were able to show significant improvement in all key performance measures or key quality measures. And the length of hospital stay reduced, the complication rate reduced, that itself will improve the outcome. So this physician-led model has been implemented in Himachal Pradesh, Punjab, Kerala. Recently, Maharashtra has joined in the same model. And so on a large scale, we need to involve the government sector. We need to focus on physicians, and the thrombolysis should be free of cost. And if you look at the thrombectomy, that is where we need to, when we develop this spokes, we need to have at least 1 or 2 hubs in each state for the government sector, or it could be a private-public partnership, where we are currently working in Punjab. Like 2 hubs, one is the PGI Chandigarh and one is our center. So this is how we need to really focus on how we can develop stroke care. And in terms of funding in government sector, funds are available under the state NCD program, and it is for the healthcare professionals or a stroke champion from each state could approach the government and mobilize those funds for the developing the program. The top-down approach with MOU, the Angels, they are expanding it in many other states now. So if you want to really improve stroke care, reduce the burden and disability and improve the functional independence, we need to focus on government sector hospitals, district hospitals, focus on physicians. TPA should be, thrombolysis should be free of cost, and we need to create hubs where thrombectomy is covered either through Ayushman Bharat or through some other ways by which the patients can afford the treatment.
Dr. Pandian, could you talk through how many people might be getting a thrombectomy right now, and what is the potential to get, or how do we get more people to a mechanical thrombectomy?
Sorry. Yeah, so in India currently, we don't have actual figures. It's all assumptions, and also based on from the industry, also from the Medtronic data, and the data that has been published is in Journal of Stroke Medicine, the mission thrombectomy. Probably currently, less than 5%, I would say less than 3% of eligible patients receive thrombectomy. Again, it is largely in private sector and more in the southern part of India as compared to other regions of the country. There is a big need to develop this through the hub and spoke model.
Got it. Well, thank you so much for that, Dr. Pandian. I'll come back to you with some more questions. For the audience who's joined, you can ask your questions in the chat, and I'll pick it up in about 20 minutes. So I'll come to you, Prateek. Prateek, so Dr. Pandian spoke about the hub and spoke model, and I think Medtronic has played a significant role in enabling that, and you have at Medtronic done that. So wanted to ask you about the hub and spoke model. How does it work? And if you can elaborate on that.
Sure. So hi Prashant, and good evening to all the audience. Before I answer that question, I just want to add a line to what Dr. Pandian said. Now the good thing is, because government is also putting a lot of focus on thrombectomy, and thrombectomy is covered under PMJ scheme. And now what, as a call to action, we need to take is all the state government or hospitals, they need to work on adoption of this therapy and leverage what the government is supporting for. Now coming back to the question on hub and spoke, so this is an innovative model, and with this model, the good thing what we can talk about is connecting the referral center with the key center, which is fully equipped with the complete ecosystem to provide a treatment to patient, is called, I would say in my language, a proper hub and spoke model. And this with this model, what effectively this model will do is the right healthcare intervention which is needed at the right time, especially for therapies like stroke management, because there's a golden period of 24 hours, and within that 24 hours the patient need to be treated. So hub and spoke model, basically connecting the referral center with the hub center and getting patient treated at the right time, is a hub and spoke model for us.
Makes sense. And what is the opportunity that we can address with this hub and spoke model?
Sure. So Prashant, opportunity, I would say it's huge with the population what India holds, and just want to add one more line. The number of deaths with stroke is much higher than patient who died because of COVID. That's what the number I can roughly say. And when we talk about opportunity, see, hub and spoke model is required to expand in cities, especially the tier 2 to tier 3 market, for such specialized procedure, where we need to build up the capability of the center, and also and create awareness about the therapy. Also, it's across India, I would say, as of now, there are only 10 comprehensive center which are currently covering 25% of the population. And you can understand, it's only 25% of the population which is getting covered currently. The capability building cannot happen overnight, and as of now, what we are seeing, the way infrastructure is getting developed in India, there are more than 650 medical colleges, and every year there are 30% growth of new medical colleges and hospital which are coming up. So from an infrastructure capital point of view, the development is happening. Purchasing is also happening at a very fast pace. But at the same time, when we talk about development of therapies which are specialized therapies, it will happen at a phase manner. So as of now, it is 10 centers which is covering population of 25%, where we have a scope to improve a lot and to go to masses.
Got it. And could you, so I think, we also have a partnership with Medtronic, and we use AI to support this hub and spoke model. So do you want to quickly talk about the potential for AI to widen the net and extend appropriate stroke care to more patients?
Sure. So as of now, our plan is within next one year time, we want to expand this hub and spoke model and maybe create more hub model around 20 to 30 centers across India. And basically it cannot happen only with the part. It's a lot of multiple things are linked to it. When we talk about 20 to 30 center, we need to establish a partnership, we need to support skill development, we need to work on capability building, and directing patients to these center is the most important piece, so that we can save lives. So that's what the vision, what Medtronic as an organization we are having, and also create these centers as high volume centers. And maybe I can give few examples of centers with whom we have already collaborated. Aster NIMS Calicut, Zydus Ahmedabad, Artemis Gurgaon, CMC Ludhiana, where Sir is also coming from CMC. These are all centers which are really comprehensive centers. And maybe just to give few example, like for example, when we talk about Artemis Gurgaon is a hub center, and they are covering peripheries of Delhi like NCR. They are covering Rohtak. They are covering Hisar. Similarly, Zydus Hospital, it's covering Mehsana, Himmatnagar. Similarly, also Zydus, in the month of Feb, they have done an announcement where they talked about the partnership, what they have done with Qure and Medtronic, how it is helping them in a positive way, and how patient flow have increased post the partnership. So as a vision of our organization is typically very clearly, the first point is have more number of centers, build capabilities in all these centers, and provide all kind of support.
No, makes sense. In fact, like you mentioned Zydus, there is a comment from Zydus here as well. Phillips has said that physician focus is imperative. India has a shortage of stroke care and almost none in the rural areas. One good example is Zydus. With an AI capability, a team of stroke experts at Zydus is helping analyze the CT scan done at a partner or spoke hospital, supporting doctors there in making decisions about treatment. So basically, at the spoke side, you're doing a CT or a CT angio or an MRI, and then a mobile app enabled with AI is then processing those scans and alerting the doctors at the hub hospital that there is this thrombectomy patient or a stroke patient that requires care, right? So that communication, the ability to read a scan becomes much faster. I mean, with AI, you can actually be able to interpret a scan within a couple of seconds, in fact. And so that notification can happen very, very quickly, and you can connect the different hospitals. So I'll sort of take it to Dr. Pandian. And also, Dr. Pandian, maybe get your thoughts on the hub and spoke model as well, and what the opportunity is on that, and where can that model how can that model?
Yeah, I think Mr. Tiwari was talking about how this some of the hub and spoke models in private sector hospitals, and I think this is a very good opportunity now, particularly in the certain states where already the hub and spoke is running, not for thrombectomy but for thrombolysis. So one is Punjab, and then second is Himachal Pradesh, Kerala, where probably this is the right time for introducing AI in the decision-making process, and for the peripheral hospitals and in the hubs. And maybe if you can demonstrate this in one of the states in the country, then probably governments will be very keen to roll out in other states. So probably it's very important now to show that in private sector definitely it is working, and we need to scale up now. And but for in the government sector, we need to show the government that deploying this and how it improves arrival of patients and the rapid assessment of patients and decision making for thrombolysis and thrombectomy. So there's a big opportunity, I would say, to work with the government sector.
How do we, and maybe, I mean, this is a difficult question, but Dr. Pandian, how do you think, I mean, see, like you said earlier also, the private sector is easier to work with. I think figuring these kinds of technologies out, integrating technologies into the clinical workflow happens much faster in private sector. How do we take this to the public, to the government sector? What are the ways to get there?
Yeah, so number one is, if we have case studies and some data that we have already done in certain places where, like we can show the example of Tejpur, that is very, very important, where there's no neurologist. The government will be very keen to have something similar at a secondary level hospital. So one is through case studies. Second is probably a feasibility study in a small scale if we can do. For example, in Punjab, all the district hospitals have CT scans through PPP model, and MRI scan inspected district hospital through PPP model. whether we could leverage with this private imaging provider and then try to uh, quickly assess the scan. For example, currently in Punjab, for them to report through teleradiology, it takes time. A stroke patient is in an emergency in a civil hospital, and the doctor gets a CT scan. But now the reporting part. So that is where the AI can play a major role. I would say if we can deploy in one district hospital and demonstrate to the government, then the process and the care will definitely improve. I'll give you an example. About I think 6 weeks ago, I got a call from the civil hospital. We have the Punjab Stroke Group, a WhatsApp group, and they posted that so and so CT scan is done and not reported because it takes by teleradiology they have to wait, and they posted the scan, and I said there is no hemorrhage, and I asked for the clinical symptoms, NIHs, and then we were able to decide on thrombolysis. So this is where AI can play a major role in government sector.
No, absolutely makes sense, and that is the opportunity, right? That radiologists will take time to read. They may not be available immediately, and even with AI, you can actually read the scan immediately and alert the radiologist, alert the physician. Yeah. So
yeah, that is
that's the opportunity that we are trying to address. I had one last question for you. So as the president-elect of the World Stroke Organization, maybe could you talk us through what are the ways WHO is trying to address stroke care in India? Question for you, Prateek. Somebody, there is so Lakshmi, who's a PhD candidate from MDI Gurgaon. She's asking about, she works on adoption of AI in healthcare, and she wants to discuss more about the Medtronic work with Artemis in Gurgaon. And so maybe you can share a little bit more about that, about the work with Artemis here.
So basically with Artemis Gurgaon, what we have done a partnership agreement where the leading neurointerventions, it's a leading neurointervention center, and the partnership is basically Artemis Gurgaon is a hub hospital and we have collaborated. They have some spoke centers in, for example, as I said, in NCR, Rohtak and Hisar. Any patient who's coming for a CT scan, and if the patient is diagnosed with stroke, with the app Qure.ai app, that intimation immediately goes to the doctor who's based out of Artemis Gurgaon, and if the patient is having symptoms, and if the patient is really fit for if the patient is having stroke, the immediate attention has been given to the patient, and the patient has been asked to shift from the spoke hospital to the hub hospital. That's the way we are trying to collaborate with hospitals, and that's the way patients' life has been saved with the right intervention, because the golden period, as we talked about, it's only 24 hours.
Got it. Thank you so much, Prateek. I think Dr. Pandian is back. And Lakshmi, if you have any more sort of follow-up questions for Prateek, you can post them on the chat. And anybody else, others, if you have any other questions, please do post them in the chat. Dr. Pandian, now I think we should be we can at least see you clearly. Hopefully, you can also hear you.
Internet problem at home. Okay, I think I'll start with a question on World Stroke Organization. Yeah. So from World Stroke Organization, we have this program called Global Implementation Task Force. So we have started the implementation of stroke care throughout the continuum of care, stroke care, starting from Latin America, the South American countries, Brazil, then Chile, Uruguay, Paraguay, so many of the Latin American countries. Along with that, we have started the WHO Stroke Center Certification Program. So that is really coming up well in Latin America. And then in New Delhi, we recently had the Global Stroke Alliance WSO ministerial meeting before the G20. From September 6th to 8th, we had this meeting. There were representation from 17 states from the Ministry of Health, and 7 health ministers had come, and also representation from 7 neighboring countries from Southeast Asia. So there was a New Delhi declaration that was signed by the ministers and also their representatives about developing stroke care in their own country, in their own state. And also we released the World Stroke Organization and NABH Stroke Center certification standards. From October 1st, the application process will be opened up, and centers can apply, and this will really improve the quality of stroke care, as well as more centers will come forward to get certified. We are looking at doing it in 20 to 25 centers every year, at least in the next 2-3 years, and then see how it goes. So this is one of the major things that we are doing in India.
Got it. No, that's thank you so much for that answer. It makes a lot of sense, and I think so. This model has been proven. You're saying in other countries in Latin America, and now you're sort of bringing that model to.
So in Latin America, so they have rolled out the program, and for a couple of years, with WSO support, they will run. But we are handing over to the local or regional or the country stroke organization. And India will be the first country where this program will be jointly run with NABH, and then finally NABH will completely take over after 2 years. We don't want WSO to be, completely running. We don't have resources like that. Empower the countries, and then they take off with their the program. Yeah.
No, makes sense. I think maybe I'll also ask Prateek the same question. I think the partnership we have and the hub and spoke model that we have in India now with Medtronic sort of enabling or supporting that, is that something that you also want to take to rest of the world? Is that something that you think can also benefit some of the countries that Dr. Pandian mentioned?
Absolutely. Means I was there for the G20 meeting stroke summit, and also I was just going through the agenda of the entire summit. Plus, we were also checking any other therapy where government is putting that kind of effort or focus. I think it's only stroke where the entire G20 summit, which was there for almost 3 months, stroke is the only therapy where government is trying to put a lot of resources, a lot of focus, and that clearly indicates whether it is India or other countries, they are clearly focusing a lot on stroke. So it's a very good news, and we were really surprised and also happy, pleasantly surprised, I would say, and really happy to see the progress and the entire discussion.
There are a couple of audience questions, so I'll get to those. Maybe I'll take Lakshmi's question first. It's a follow-up question to your answer about Artemis, Prateek. So she's asking, what all were the factors Medtronic has considered when providing AI solution to Artemis Gurgaon? Example, policies or agreements?
Okay, so if I'm able to understand it properly, please correct me, Prashant, if I'm not understanding. So Lakshmi wants to understand what is the agreement and what is the maybe a commercial agreement what we have done with Artemis. That's what the question is.
I think looks like she's wanting you to address policies and agreements in the organization. So maybe what are the agreements and what are the maybe policy changes also in terms of adopting AI? And maybe I think she just responded maybe any other factor of adopting AI.
Now, as I said, I think in my previous points also, I think the most important thing when we identify a hospital or a partner with whom we can partner, is there are a couple of factors which we really want to develop. It's not only the collaboration where we are doing a like a agreement and we are just moving away. uh, what we typically, when we do a collaboration with a center, what we also work on the capacity building. When we talk about capacity, that includes training, education of staff, also the hub center and the spoke center. Also, when we think about skill development, because as Sir said, Dr. Pandian said, uh, stroke, as of now, the number of doctors who are managing neuro intervention is very limited. So that's where we also try to play a role in terms of training and education, getting more and more doctors to understand new therapies and new products, and whether as an organization where we can support in training and education. And as I said, the partnership is also now, for me, it's not when we say artificial intelligence or AI, it's not AI, it's access and intervention. These are the two important elements what we try to focus as an organization, where how do we use artificial intelligence to create more access and more intervention for patient is something where we try to work on. So maybe, Lakshmi, my answer is very long, but I hope you are able to understand it.
No, absolutely. Very, very well put, Prateek. I think the reality is that we all think about AI or any other technology, but you have to create value for the patient. You have to create value for the physician, neurologist. I mean, and you have to create value in the ecosystem. That is all that matters. I mean, whatever the technology be, right? So very well put that AI is not. I mean, you are actually creating access for the patient through this. Right? So absolutely makes sense. Coming back to, I think there is one question. I think maybe Dr. Pandian, you can address this about real world evidence being
Yeah,
used
so the
in
evidence-based
India for
treatment.
stroke care.
Yeah. So
So this is a
there are
question
two or
from.
three ways by which we can capture that, the real world evidence, how centers are utilizing the evidence-based treatment. So that is through quality registry. So there is a couple of registries. One is Rescue, where centers enter data. The key quality indicators are monitored, and there is an award. Quarterly we give them award if they reach these criteria for diamond, gold, platinum, silver, etc. So that is one way we can assess, and there are close to 500 hospitals which are participating in the rescue registry. Then the second registry is SITS registry, but not many centers are involved in that. But the rescue registry is one quality registry through which we can see the quality parameters. The second one is the Indian Stroke Hospital Registry, hospital-based stroke registry, which is run by the ICMR. That is a funded program. Probably currently close to 50 centers are there in the country which are entering data. They are also entering quality data, but that is not openly available for sharing and reporting. And you need to get permission from ICMR. And based on this, the only way currently we can know that these evidence-based treatments are being implemented or not is through the rescue registry, which is expanding very fast.
Thank you so much. Thank you so much. I think there is a couple of questions on patient data privacy from Pranav about patient data privacy when we are using AI. And there is a question about after sales service from Lakshmi again on after sales service for AI. Maybe I can take this. I mean, so I think the patient data privacy part, a lot of times the data is anonymized, so we don't typically collect at Qure. And typically these kinds of platforms, AI platforms, may not necessarily always collect patient information because they don't need. I mean, AI needs only the pixels of the image to process, the pixels of the CT scan, pixels of the MRI. So it's only processing that. It's not processing it does not require any actual patient demographics or patient name or anything of that sort to process. And even if that is there, I mean, typically, at least from Qure perspective, I can say that the data handling and the data protection mechanisms that we have are put in place where we make sure that nobody has access to that kind of information except the physician who's directly treating that patient. So access is severely limited and only for people who are part of the care team for that patient. So that's on the data privacy. On after sales service, again, I think Prateek mentioned the support that education that is provided to these hospitals, where very frequent training programs are provided. We are training teams on the use of the technology. We are working with them on integrating the technology with their existing software ecosystems. Again, there is support. There is 24/7 support, so you can reach out to. There is a single point of contact. You can reach out to somebody if there is an issue that you face. So that kind of service is also part of the offering to hospitals. So I think when we are providing this, we do provide that after sales service to the hospital. So that's that's answering the question from Lakshmi. And then I think there is a question from Prashant, where his question is, AI and machine learning tools can augment stroke management across the continuum of care, including prevention, prognostication, neuroimaging diagnosis, treatment, and recovery. I wondered why in India we don't learn from the West for stroke. Studies show that artificial intelligence tool developed by the researchers at the University of Copenhagen was able to recognize stroke symptoms quicker than emergency call handlers. I think we are addressing that, I think, but maybe Dr. Pandian.
Yeah, I think this is where we have problems when researchers develop a product. I won't say AI but if you let us say one drug or a technology, when it comes to India, it becomes very, very expensive, or it has to be something developed from within the country. There are multiple stroke trials. They use a couple of products, and so when those products they come to the market, we can't afford. For example, one of the companies, they gave me their product for 1 year, on a research basis. But after, I think they extended to 18 months, and then after that, my institution could not afford the huge cost. So that is where the translation is an issue. One of the things that like working with your group was, we were able to write some grants and for Indian situation, LMIC situation, so that we need to have something which everyone can afford. So at a large scale, so that is not only in the technology, but also if you look at the drug trial. If you have a drug which is patented and then become off patent, it takes years. So the cost is an important factor, I would say, why we are not able to adapt quickly in India.
Prateek, any thoughts?
I think the only thing what I want to add to Dr. Pandian's comment is, see, I think all the right steps are being taken, because with the Ayushman Bharat scheme, now the coverage is huge. The huge population is getting covered. And also so there are two things. One is the demand and second is the supply. Demand side, government is also investing on a lot of hospital, all the public hospitals. There's a lot of government hospitals which are coming up. As I said, 30% is the growth rate in government hospital, and sir also talked about it. The public infrastructure is developing at a very fast pace. And second is on the supply side, where government is coming up with all these schemes like Ayushman Bharat scheme. When you go to Jammu and Kashmir, there is a Sehat scheme. When you go to Gujarat, there's a MA scheme. So all these schemes are really supporting patients patient population, and that is really helping us to get more and more patient treated. I think maybe from I feel there are three things which we really need to work is one is, as I said, AI is now access and intervention, and also awareness. These are the three things what we need to really work on: creating more awareness about stroke, getting patient treated at a right time, and also sending these patients at a golden period. Whenever suppose if anyone is getting stroke. So these are the three things which I feel like as a industry, as surgeons, and as government of India, all three of us we should work around.
Thank you so much, Prateek. I just wanted to add one topic. I think one thing which always sort of sticks with me is we don't have to go to University of Copenhagen. We have talent here in India. We can build these solutions here in India, and we have built it, and we've deployed it, and we are actually creating impact. So we don't have to copy from the West. We can actually build our own solutions here. So just
Yeah.
wanted to
No,
say
actually,
that.
very means that reminds me one point, which I think last month we were having a meeting in Gujarat, and that's where I also talked about this. See, in India, the best thing is from day one when doctors are in the MBBS college, when they are doing their MBBS, from day one they are seeing patients, and I think that's only practice in India. Unfortunately, this is not with engineering. When we go in an engineering college, ideally it should be in a Tata Steel or Lakshmi Steel somewhere, so that we can learn engineering from day one. But with doctors, I think that's the talent what we have, because they from day one they are seeing patient, and the amount of talent and the amount of knowledge what Indian doctors are having. I don't think so anyone across globe will be. Even doctors who are doing like the topmost surgeons in US, they're Indians only. So Indians are ruling the way. So it's an amazing talent pool what we have.
So thank you, Prateek. I will. So we are. I mean, this went 45 minutes went by so quickly. So we are at the end of the session. I'll sort of. There is one question from Renata, which is, what are the major hurdles that India faces in improving acute stroke care across the country? Maybe I can ask both of you to speak for a minute about maybe one hurdle that India is facing in improving
I
stroke
think
care.
the one hurdle I would say is
Dr. Pandian first.
uh, the neurologist and the stroke neurologist. We need to really work with their own state and the government. If every state we have one stroke champion, we can change the stroke care in the country, because there is no problem with funds. Funds are available every year. Some of the state they send back the money which comes for a national NCD program for their respective states. In crores they send it back to the central government. So there is money. It is through the right person in the health sector, in the health ministry. We need to have approach, and that is where I would say industry's role is very important. Whether you take Angels program or through Medtronic, we need to work together. Then only we'll be able to change the landscape of stroke care in our country.
Thank you so much, Dr. Pandian. Prateek.
So I think Prashant, this will make you happy. What I'll say now. So I think use of technology in the best possible way to save life, and that's where Qure.ai is coming up. I think that's the one element which we as a group we need to work around and get more and more spokes and hub and spoke model implemented in India. And maybe we are targeting 30. We should go beyond 30, and we should touch at least 50, 60 in a year's time. And I think that will really help us to widen the scope of work what we are trying to do.
Well, thank you so much, Dr. Pandian. Thank you so much, Prateek. Great session, and I think the number that stood with me is the 3% of people who are getting a thrombectomy. Right? That definitely can improve a lot, and hopefully through this hub and spoke program and using technologies and AI, we can make a difference in patients' lives. So thanks so much, and look forward to a a lot of work together in the next several years.
Sure. Yeah.
Thanks.
Thank you, sir.